Excuse me, doctor.
I am here.
Dr. Clarke, I'm exasperated. We think we're getting over Delta, and then all of a sudden, we get this new variant, and it's more transmissible than the previous one. Tell us a little bit about this particular one, and where do we stand today as you understand it?
Well, that was an excellent rundown of the numbers and some of the facts that Dr. T mentioned. But, let's be clear, we weren't really getting over Delta. We had a lull in Delta, and even without Omicron, we were concerned, given that, looking back at last winter, that we knew that people were going to be going back indoors, especially as the weather got colder and the holidays came around. We cautioned and urged people to, be careful, but that was all because we knew that, all things being equal, Delta would result in another surge in the wintertime. But now we actually have this faster spreading variant, Omicron, which apparently has actually been in the United States since November 15th. That's when they saw the first international traveler who tested positive for Omicron here. So it got here even earlier than we thought, which was originally the beginning of December. And just as Dr. T said, there's still some things that we're not sure about. One thing that we did learn recently was that the monoclonal antibodies, which are the antibodies manufactured in a lab that are then given to people when they come down with COVID to prevent them from getting sick, those monoclonal antibodies don't appear to work well against Omicron. And so they're going to have to be new ones that are manufactured and put together in order to administer to people who come down with the Omicron variant. So it has some real life implications. All the rest of the treatments will probably stay the same, but it's important to understand that. It's important to understand, will the existing vaccines work? It seems like it might evade the antibodies produced by the existing vaccines. However, the good news is that if you're boosted, so you have your third dose, you have sort of a huge influx of antibodies now to overwhelm the variant. So that does seem to be effective. So I would really encourage everyone, especially if you're in a high-risk group, please go get boosted if you have your first 2 doses. And if you have no doses at all, it's time to go ahead and get them.
Because many people, through hesitancy, and I don't know, you're listening to all of the disinformation and misinformation, Dr. Mel, and so people are really dying because of people lying. So so people are dying because of lying. You see what I'm saying? And that's a sad commentary because, when did people stop trusting science, Dr. Mel?
Well, I think it's not so much that we stop trusting scientists, and I'm talking about the African American community. We stop trusting scientists. I think that, with the overwhelming amount of misinformation that feeds into the narrative that seems to reinforce our life experience as Black people in America, it makes it more difficult to push through that and find the kernels of truth when it does benefit our community, right? And so I think, as Dr. T said earlier on, social media has really been the what has ignited this just deluge of misinformation and disinformation. University of Maryland did the wonderful study that came out of the Center of Health Equity that Dr. T leads that showed that it was the same Russian bots and trolls that influenced the 2016 election, that influenced the discussions around vaccines on social media. And those same things have just been tweaked when it came to the COVID vaccine and the names changed and the dates changed to then label misinformation to get out to our community, to hurt our community. And unfortunately, it's taken, it's really just sprung up like weeds in the fertile soil of distrust that we already have. Or social media allows you to live in a bubble of your own information, right? That information that you want to believe. And especially with social media, it actually curates the things that you click on to give you more of what you want to believe. So
wow.
you end up in this this bubble of your own making, and it can be very hard to penetrate that bubble with actual facts and evidence. I think that's one big thing. And we talked about the reasons why in the African American community, the fact that the vaccine would be harmful to us resonates more with our truth than that it would actually be helpful to us, right? And then there's the other thing of what I call the myth of rugged individualism, this American concept of my liberty is the most important ethical value that I have, totally ignoring our roots in our Africanness, which talks about the concept of Ubuntu. I am because we are, which is the countervailing, the counterbalancing ethical value that we as African Americans, we live that every day. But for some reason with this vaccine, there's a disconnect between understanding that we're in a pandemic and that getting vaccinated is actually the highest expression of love for our community and our family by actually protecting not just ourselves, but it protects those around us and it protects our community. And I think that concept is just not getting through, unfortunately, especially when we talk about this protective bubble of misinformation and disinformation that unfortunately people have around them.
Dr. King.
What would Dr. King say?
Good evening.
How you doing, Dr. King?
I am certainly delighted to be here with you tonight. I've just been listening to all that's been going on and all that has been transpiring, and I'm just glad to be a part of this.
You know, one of the things as we talk about leadership, because this is required, this leadership is required, courage is required during this time to save lives. I mean, we can talk about the politicization, and I know that in the spiritual realm, you all try to stay out of politics. But what we're trying to do is save lives so that we can deal with the other issues of life, like voting, which you were such a proponent for, and like the Poor People's Campaign, which was your last campaign before your demise. And all of those things were required in order to move this country towards the more beloved community, as you talked about it, the beloved community that you talk about. I want you to talk a little bit about courage and leadership in this time of crisis.
Well, courage is certainly very important. Courage is not really having the strength to do it. It's really not having the strength and doing it anyway. And so what we have to do is really learn to, I think a very important part of it is education. The education aspect is a reality. And from a nonviolent perspective, certainly that is the key, to educate ourselves. I said in the Birmingham jail, the letter from Birmingham jail, that in any nonviolent direct action campaign, there are 4 basic steps. Collection of the facts to determine whether injustice exists, negotiation, self-purification, and direct action. And so these are the elements, and I've always stood on the principles of nonviolence, and I think that will work today. Many people don't feel that it is necessary, that it will work, that we're living in a different period, but we're still dealing with the same issues. And if we look back historically, we will see that in every aspect of reality, in every period of history, as it relates to race relations. It took a decision by the Supreme Court of our nation to bring constitutional validity to the dominant thought pattern of that particular period. And so as we're living in this period, I think it's necessary that the voting piece is very important, and that we elect people who are willing to do justice, to love mercy, and to walk humbly with their God. So leadership is very important, and it's something that we have to look into extremely at a deep level and delve deep into that philosophy. So from the perspective of leadership, that is something that we certainly need today, and that is part of the nonviolent reaction that we should have. So I'm always really going back to the concept of nonviolence, which is rooted in love, and we were talking about that earlier. So to answer your question, as far as the leadership where we are today, I think the unification piece is necessary. I think we have been divided against ourselves in many aspects. You know, I think about Paul. I think about the different people in the Bible. The good that I would, I do not. The evil that I would not, that I do. This strange dichotomy, this agonizing tension within human nature is one of the tragic things of man's earthly pilgrimage. And that's why I stand on the basis of Jesus Christ and understand that he was a revolutionist and he was a leader. So I think we need to, in order to move forward, I think it's necessary that we go back. You know, I preached a sermon, Rediscovering Lost Values. And I was talking about when Jesus' parents was going on to Jerusalem after the Passover, they were headed back to Nazareth. And about a day later, the Bible tells us about a day later, they looked back and they realized that Jesus wasn't there. But one of the things they had enough sense to realize is that in order to get on to Nazareth, they had to go back to Jerusalem and rediscover that mighty precious lost values. And I believe that we as a nation, in order to go forward, we must go back and rediscover those precious values and bring them in today. And I think it will make a drastic reality to significant progress to where we are today.
You know, Dr. Mel, I want you to help me out with this, because people talk about, you know, if you're going to get it anyway, then why get the vaccine? I mean, because, you know, if everybody's going to get it, there's no way to elude it. Even vaccinated people have breakthroughs. How do you respond to that? I know that you, excuse me, doctor, I'm sure people have brought that up to you.
Yeah, quite a bit. First, let me say to Mr. Brown and Miss Jenkins, man, I just wish I could come through there and give both of y'all a big hug. You know, this is real, just like you said. And the analogy that I use in terms of people, you know, saying, you know, I could get sick anyway, whether I get the vaccine or not, is, you know, if you're going out in sub-zero weather, you're going to want a coat. You're going to want a couple of layers under that coat. You might still feel the cold, right? But it's much less likely that you will die of hypothermia or that you will get frostbite. It's much less likely than if you go out butt naked